I never heard my husband sound so afraid as he did.
I remember she was pretty scared. She just had the look on her face that she was really scared.
And we're here to assist and save lives, and you have to be always ready.
I was just sitting there, I don't know how long I sat, but then I just started taking my hand and going like that. So I knew there was something wrong. My cell phone rang, which was in the bedroom on the bed. When I tried to pick up the phone, I couldn't, and I was trying to swipe it. By then, it hung up. I saw it was my daughter, and the phone had rang again because April tried calling me back again. Well, then I couldn't talk. That was my first time of knowing I couldn't speak. She had already figured out something was wrong, and she's crying and she's saying, "I love you, and don't worry, Mom, the ambulance is on their way, they're getting a hold of Alan." And all I wanted to do was tell her I was okay, and I couldn't do it.
My cell phone rang, and it was 911 dispatch letting me know that my wife was having a stroke at the house next door.
The paramedic could clearly see that this was a classic presentation of a stroke, and at that time he called for a stroke alert and requested a helicopter for a standby when Air Methods did accept the flight.
We get all of our equipment, jump out, get in the back of the ambulance, and when I open up the doors, I see this lady sitting there on the stretcher, and she was clearly having a stroke. And by ground, just based on the demographics, traffic, everything, that would have easily been over an hour to get the patient to the hospital.
Put me on the helicopter, and then I was in the air. They said it took about 17 minutes. It was the time frame that I think that really made it to where there was a good outcome.
We had pre-notification of Karen's arrival by Air Methods, and so our team was actually waiting for her on her arrival. So she was taken directly from CT to the interventional neurology suite, or the neuro biplane room, and I think we were probably there within 30 minutes. Dr. Khan and the team began to immediately prep her for what's called a cerebral angiogram with an intervention called thrombectomy, which is removing that thrombus that's causing the blood flow interruption.
Once they moved it and I had the total flow, that was that warm, tingly sensation that was life going back to the brain.
And she immediately, on the table, began to understand and able to speak.
When I got the bill from Air Methods, I was getting nowhere with the insurance company. Your patient advocate actually contacted me.
I explained the procedure, that there was an underpayment, and the best thing that we could do is to call the insurance. They underpaid, and they need to pay it.
If John hadn't made contact with me and then provided the guidance, point me in the right direction and tell me what I needed to do, what resources I need to put together, and how to file this appeal, I'm not sure I would have found my way through it on my own. John really stuck with me. We didn't get the outcome we wanted right away. The outcome is the insurance company finally agreed to pay the bill in full.
Having agencies like Air Methods can greatly impact the outcome of our patients. Every minute matters. Every minute is brain lost, so having those patients dispositioned to the hospital as quickly as possible so they can get these interventions as quickly as possible will greatly impact their neurological outcome.
Having air transport as a service, we have access to blood products, all kinds of services and equipment that you wouldn't typically see on a regular ground transport. We're almost like a mini ER, mini ICU that we can get somewhere really quickly and be able to intervene and promptly treat the patient.
We're the poster child for rural EMS. A lot of these people in South Georgia and North Florida, there's a lot of folks here, and there's a lot of area that we serve.
I went to work 10 days after the stroke. I work at the Lake City VA. Every day I'm in contact with somebody who's had a stroke. So I know where I could be. I'm so lucky to be talking, is what I feel like.
Every day I wake up and count my blessings. What could have been and what we have is just so different. We're looking forward to spending a lot of years together and enjoying each other, and I'm not sure that would have been possible if she hadn't received the care that she did.